Hello, everyone. Dr. Mandell here with you. Hope you're having a pleasant day or night, regardless of where you are worldwide. I want to say hello to every one of you out there. And today we are actually streaming live via the internet as our live chat will come in right now. But let's get moving on. We are talking about ways and how we can lower our blood pressure and our pulse rate. Let's go over a couple things. We live in an environment and in a world today where there's so much going on with problems of stress and jobs and hurricanes and things that are erupting, and just there's a lot of stress out there. And relationships and families and health and all those kind of things kind of overlap each other. And, this kind of shakes us up. This kind of gets us in a nervous, round up mode. Our behavior starts to change. Our stressors start to kick in. Our adrenaline kicks in. And this leads to a lot of anxieties. We'd all say that we all have anxiety. We all have fear. We all have pressures. We all have responsibilities. We have to get up around the clock. We have to go to work. We have to go to school. We have to study. We have to face challenges. And guess what? All these kind of things raises blood pressure, raises our pulse rate. It increases epinephrine, adrenaline, catecholamines, cortisol. And what does all this do? It lifts up the nervous system and allows it to work over time. So I'm going to show you something really interesting and really great. I think you'll really appreciate this. We're going to go into some different self-help remedies that you can do at home on how to lower your pulse rate, how to lower your blood pressure. But the first thing I want to go over with everyone out there, I always recommend everyone to get evaluated with your physician if you are having what we call a rapid heartbeat, or if your blood pressure is elevated. It's always good to get examined, always good to get evaluated. And a couple of things I'm going to show you, one particular, I want to make sure that you are okay before you do this, and I'll explain as we get to there. So let's move on to the fun stuff. Let's go ahead and, excuse me, get rid of this. And we'll talk a little bit about tachycardia and bradycardia. Tachycardia generally is over 100 beats per minute. Bradycardia is usually under 60 beats per minute. Generally, normal pulse rate is anywhere between 60 and 100, average about 60 to 80. Generally, what happens is as your pulse rate is higher at rest, indicates that potential problems can arise more frequently than not, as if your pulse rate is lower. So generally, you're asking, how do I get my pulse rate lower? Exercise, aerobic exercise, being in better shape, keeping weight off, eating well, taking care of yourself, monitoring your stress levels, and being in a good mode, or a good positive mental attitude mode, to allow your sympathetic, which is the fight or flight situation that secretes epinephrine and adrenaline, to become diminished and slowed down, and to allow the parasympathetic, which is the relaxation part of our autonomic nervous system. And that's what we're going to focus on today. So the parasympathetic is what slows it down. Now realize people may have arrhythmias, which are quite common, and there are many things that can cause tachycardia, like a heart attack can actually cause a rapid heartbeat. So once you're evaluated and you understand more about your own body, then you will definitely be able to do these particular techniques, and I think they'll be quite fascinating because you'll see quick results. Let's go on to our first one here. It's the old simple one. It's about the breathing. The first thing I tell people, when you're in anxiety and you have stress and your pressure is up, because generally when your pulse rate is up, your breathing is up, your blood pressure is up. Everything seems to go up altogether. That's the way that the nervous system works, because of the sympathetic surge of epinephrine, cortisol, and adrenaline. So what we want to do is we want to slow it down. So the first thing I'm going to tell you to do is when we breathe, be in a position, either sitting up in a chair, sitting up in your bed, anywhere. I don't really like the fact that you have to lay down, but if you do lay down, I don't want you to fall asleep. This is something that's pretty quick. Generally, what we're going to always do is breathe in through our nostrils and exhale through our mouth. But what we do here is that we're going to breathe in about 5 to 8 seconds of air through our nose, and then we hold it for about 3 to 5 seconds, and then we blow out that 5 to 8 seconds again out of our mouth. So it's kind of like this. Hold it 3 to 5 seconds. Then we blow it out of the mouth. 5 to 8 seconds. Try that about 5 to 10 times. You'll feel your whole body come down. Quite amazing. So primarily what we're doing, we're breathing in through the nose 5 to 8 seconds, holding it 3 to 5 seconds, breathing out of the mouth, and doing that for 5 to 8 seconds. Just try that. You'll start to notice your muscles start to wind down, your mind winds down, your breathing winds down, and guess what? Your pulse rate will come down and your blood pressure will come down like that. Quite amazing. And the more you practice this, the better you get, and the easier it is for your body to react to what you're trying to work on, which is obviously bringing it down. The next thing, very simple. I don't know if many people have heard of this. I'm sure a lot of you have. It's called the Valsalva's maneuver. The Valsalva's maneuver is very simple. What we're going to do here is that we are going to take a deep breath. And when we take a deep breath, we're going to hold our nose and we're going to push out like we're pushing our bowels, like we're going to the bathroom. So as we take a deep breath, we're going to push out about 5 seconds, then blow it out. And you'll do that a couple of times. And what that does is that stimulates the vagus nerve, cranial nerve 10, the vagal nerve. And by stimulating the vagus nerve, this vagus nerve works directly from the autonomic nervous system to the heart. It slows down the heart. It slows down the pulse. It slows down the blood pressure, and it brings everything way down. This is the Valsalva's maneuver, and this is an excellent thing to help trigger the vagal nerve, which is responsible for the heart rate. So by doing this, you hold the nose, take a deep breath. You blow out, but hold your mouth, hold everything tight as if you're going to the bathroom, but you're not. And then after about 5 seconds, you'll blow it out. That pressure stimulates the vagus nerve. Okay, so the next thing that we're going to do is that we're going to, let's go to here. Give me a second here. The next thing we're going to do is we're going to work on the carotid sinus. This carotid sinus is something that is going to make a tremendous difference. I want to let you know about this carotid sinus. As you look at the carotid sinus here, you'll see that what we're doing is we're stimulating in the area of where the common carotid artery is. And that common carotid artery, you have it on both sides of the throat. And what you're going to do is you're going to go down from the jaw, and you're going to make your way down on the corner of the jaw right here. You're going to come right down. You'll feel your pulse of the artery, and you'll come off just off that artery, and you'll stimulate that area for about 5 to 10 seconds. Okay? But as you stimulate that area, I don't want you to push too hard. I don't want you to do both of them at the same time. But by stimulating that area, you are actually working on the baroreceptors reflex that's stimulating it right to the heart from the vagus nerve. And by stimulating that, we are working on the SA and the AV nodes. And by doing that, we are actually slowing the heart rate down, which is going to bring down the blood pressure and bring down the pulse rate immediately. Quite fascinating. You could do both sides, and it's something that you will see excellent results. Okay, so you can look at that chart there. That is a carotid sinus by working the baroreceptors, stimulating the vagus nerve that goes to the heart, that slows the heart down by getting that area right on the corner of the jaw, right below it. Take your fingers and just kind of massage it right just lateral on the outside of that carotid artery. When you feel that artery pulse, come up a little bit and just stimulate that area at about 5 to 10 seconds. The last one is called the dive reflex. Now, what is a dive reflex? A dive reflex is quite fascinating. For divers that go into cold water, what happens is the body is quite amazing that it shuts off, it vasoconstricts the peripheral parts of our body, our arms and our legs, by limiting the amount of blood flow to our arms and legs and conserving the blood flow to our heart and our brain. And the reason why it does that, the body automatically, it uses this parasympathetic autonomic nervous system. And what it does, it slows down the heart rate lowers the heart rate and the blood pressure so we can conserve oxygen, because when we're underwater, we need to conserve that oxygen. So instead of you diving into an ocean and diving into a cold pool, you're going to take your head and put it into an ice bucket. That's right. Put your face into an ice bucket. And as you hold it there, you'll notice everything starts to drop. Your blood pressure will drop, your pulse rate will drop, and automatically you will see a tremendous change as a result of this parasympathetic reflex. Okay, that is called the dive reflex. And that's it. Those are the few main things I wanted to share with you. They're quite fascinating, because people out there who have anxiety, who have stress, who wants to get the blood pressure down, these are some little tricks that you can do. And believe it or not, once you're at in a good health risk and you've been checked out and everything's good, I see no problem with this. But I always tell people, if your heart rate is really high and it stays high, and you're having symptoms of dizziness or pain or tingling into the arm or into the chest or into the jaw, or you're feeling, sweaty or fainting, yes, that can be indicative of a heart attack. But most people are not going to have that. But I don't want to take a chance with anyone, so I will tell everyone to make sure you get evaluated with your doctor. You're in good health, and then by doing these different remedies, maybe just one of them, the breathing one, or maybe just the dive reflex, or maybe the carotid reflex, or the Valsalvas. Maybe one may work great for you. But these are some great things to get the blood pressure down. It's very fast and effective, and I'm saying fast, within seconds. I really hope this gives you a lot of good insight. Share these videos, and I ask you to subscribe if you have not, if you are new to the channel. Many great self-help videos on my channel. Check them out. Many great musculoskeletal, biomechanical, forward head posture, radiculopathy, a lot of good nutrition. Give me a big like here as well, if you don't mind. Check out my Facebook, Motivational Doc. I take a lot of questions over there as well. Leave your comments below. We'll get lots of people out there that will respond to this. I love to hear how you do. You may want to challenge your own body to say, wow, that's really cool. These things really work. Make it a great day, and we'll catch up with you real soon. Bye-bye now.